Thank you for joining us for this virtual town hall featuring your questions for state and federal officials about the COVID-19 pandemic. We'll join our panelists in just a moment through video conferencing. First, here's where we stand as a state and as a nation. Health officials say Hawaii has successfully flattened the curve with new cases in the single digits for weeks, robust testing, and a healthcare system prepared to handle any influx of cases. Across the nation, states are reopening for business at varying levels as the number of cases climb in some spots and flatten out in others. Federal health officials continue to warn of a spike as reopening occurs and of a second wave of cases in the fall. On a state level, Governor Ige has plans to transition from a safer at home level to an act with care status, which reopens medium-risk businesses. For now, all counties' beach parks and most parks are open. Play courts and pool facilities remain closed. Retail stores and malls were also given the green light to reopen. Maui and Kauai DMVs have partially reopened. Hawaii County announced it will reopen the DMV on June 1st. Still no word yet when Honolulu City satellite city halls will reopen.
We would like to welcome to this panel and thank for participating Governor David Ige, Representative Ed Case, and Representative Tulsi Gabbard. Thank you so much for being here. The first question is for all participants. Hawaii is transitioning from the safer at home stage to the act with care level in dealing with this pandemic. How would you rate Hawaii's response to the COVID crisis based on infection rates, testing, and economic impact? We'll start with Governor Ige.
You know, certainly the impact on testing rate and on the healthcare side has been outstanding. We do know that the people of Hawaii have responded terrifically well, and the state of Hawaii continues to lead the country in the lowest infection rates and the lowest fatality rates. And we have more than ample capacity. Our private labs have stepped up. And we now have the ability to test up to 5,000 individuals per day, and everyone in the state who needs to be tested can get a test. We have more than 40 test locations all across the state, including Molokai and Lanai. And as I said, those who need to be tested can be tested. Of course, you know, the economic impact of the 14-day mandatory has been devastating. We went from having the lowest unemployment rate in the country to the highest unemployment rate in the country in the matter of 4 to 8 weeks. And certainly that part of the response, it has worse, were expected because of the measures that we took to ensure the health and safety of our community.
Thank you. Representative Gabbard.
You know, there's a lot more that needs to be done. I think that it's too early to start saying, well, how do we rate the response now as the environment continues to shift and to change? You know, I agree the people of Hawaii have been very focused on acting in the best interest of themselves, their loved ones, and our communities. We still have a lot of work to do in the area of broadly and in a widespread way increasing our testing capability, as well as making sure that these tests are ones that are accurate with rapid results and are easily accessible. Contact tracing is another area that I know is at a central focus and must be at the heart of how we look at the way forward. I know I have been kind of tough and critical and placing a lot of pressure on Governor Ige and his health team, but I want to commend them. I want to commend Governor Ige, Lieutenant Governor Josh Green, and the health department for where we are now, where they are taking very seriously the responsibility of the public health and what that path forward looks like with that focus on testing and contact tracing.
Thank you. Representative Case.
Well, if we do take a snapshot in time of today, it's really good news and bad news. I think that on the good news side, we collectively, and with the governor's leadership on the state level, did exactly the right thing. We treated this first and foremost as a public health crisis and realized that if we did not deal with it as a public health crisis, that we would never be able to recover a real economic stability. And so the steps that were taken from the public health perspective, it's not an opinion, the numbers are in. Today we have the second lowest per capita rate in the entire country. The only states that are up in our league are Alaska and Montana, and they have a substantially less dense population. So the public health side of the response has been exactly correct. The bad news is that we had to do that by essentially shuttering our number one industry. That was an absolute necessity. And as a result, as the governor has pointed out, we have one of the most devastated economies in the entire country because our number one industry is shuttered, down 96%. And the fact is that had we not done that, we would have had a far worse situation than we have right now.
With regard to testing, is the state doing enough to ensure that everyone who wants to get a test can get one? Governor, you mentioned that they can, but specifically, are there measures to need to be put in place to make sure that there are adequate supplies for that the tests that we're using are highly reliable and, as Tulsi Gabbard mentions, rapid turnaround? Governor Ige, is there anything else that can be done to increase testing reliability and supplies in particular?
Certainly the state's testing efforts have been focused on the PCR test, which is probably the most accurate and reliable test for COVID-19 that we have, at least in the United States. And we have, as I said, we have more than 40 testing locations, and we are looking to expand that more. Want to thank Congressman Case and Congresswoman Gabbard for the support for our federally qualified health centers, and we are working with all of them. And as Ed and Tulsi know, they are around the state in the rural communities where they have the highest need for healthcare, and we are expanding to those locations to increase access for testing. And I just really want to say that the testing landscape is changing daily, if not even hourly, with new companies and new testing methods coming online all the time. And I can assure you that the Department of Health is plugged into that activity and evaluating testing and looking to encourage those tests that make the most sense, that are most accurate to serve our community in the best way possible.
Thank you. Representative Gabbard, is there anything more that the federal government can still do to help specifically with this testing issue?
There's so much more, specifically at the federal level where action is necessary. I want to just make sure that we're clear about where we are as we're looking at the data that we're getting from these tests. In Hawaii, I believe the rate of testing is about 2 to 2.5% of the population of our state. That same number is reflected nationally. When you look at the numbers of tests nationally that have been done, it's roughly between that 2 to 3% range, which is a really small number when you're trying to get an accurate data picture of how we're really doing, whether it's here in Hawaii or across the country. So in order to get that data picture, we need that widespread access, as I mentioned, to accurate testing with rapid results. And I really looked at, Congressman Case and I are colleagues. We have included in a number of pieces of legislation funding for the ramp up of the production of these tests as we talk about what it's going to take to reopen the travel industry, what it's going to take for employees who are going back to work as businesses are reopening. This is really the key here. The Trump administration, I think, is more concerned about trying to look good rather than do good, and trying to paint a rosy picture that that doesn't really exist, which the American people, unfortunately, the people of Hawaii, suffer as a result.
And testing and travelers, whether they be local or visitors, is a topic we're going to stick with in this next question. And Representative Case, I know this is close to your heart as well with your efforts with the FAA. Viewer Marcy Yardley asks, once you open up our state to tourism and travelers, how do you propose to test, track, and regulate the 30,000 visitors and even more locals that could potentially be coming back and forth to our islands on a daily basis? Representative Case, can you discuss this on a federal level once tourism reopens?
Yeah, sure. Well, first of all, just to go back to the previous question to lay the foundation, we're going in the right direction on testing. both in Hawaii and in the rest of the country. But we're nowhere near close, as Tulsi said, and as Governor Ige said, we're nowhere near close to where the adequate testing is that we need in both the testing and the contact tracing. Those are really critical to stabilizing this from a public health perspective and allow for safe reopening of our economy on a phased basis, as Governor Ige is supervising. And so we definitely need far more testing than we have today. We are far, far better off in that department than we were 8 weeks ago when we basically got caught flat-footed across the country, or even 4 weeks ago. The government can't make people go to a restaurant. The government can't make people visit Hawaii. The government can provide a safe zone when that happens, but we make that decision. And so take that and extrapolate that to tourism. What is it going to take for a tourist to travel to Hawaii? Well, they're going to have to feel like they're safe getting on an airplane, and they're going to have to feel like when they get off and start wandering around Hawaii, which we hope that they will be able to do again, that they are safe. And we want to know that those tourists are getting off the plane safe too, that they're not going to mess up our hard-earned gains. And so the quarantine is an imperfect solution. I think we would all agree on that. That's forced by the fact that at present, the federal government is saying that we cannot test before people get on a plane, and furthermore, deny them boarding if it's indicated that they have COVID-19. And I think that's where we have to go. We have to have some form of pre-board testing, whether it's specific to Hawaii to give the governor authority to do that, or whether it's a national standard where all travelers going through airports have some basic test by the Transportation Security Administration, or by the Customs and Border Protection, or by the airlines themselves. That's what it's really going to take. The quarantine itself is not going to, regain tourism. We want to test on the front end and start to phase out the quarantine on the back end. Otherwise, people are not going to come here.
Thank you. Governor Ige, what more do you need to know or see or be proven about the testing to even start to give these kinds of pre-entry tests a pilot project or a try? We were told by the state attorney general yesterday in a KHON2 news story that even if you could test, well, they're not reliable yet. You could still be sick, or the test could still be off. But again, this quarantine can't go on forever. What more needs to be known to pull the trigger on some degree of a testing pilot program for tourism?
A couple of things, Gina, and just to try and lay the groundwork. I agree with Ed. We continue to push outside of what we totally control, and being able to test before they get on a flight is a critical component of that. We do have a little more authority for foreign and international travelers, working with the State Department. And so certainly we're looking at potential pilots with Japan or Korea. New Zealand comes up a lot, or Australia, where the virus counts are relatively under control. And they have pretty good testing capability and regimes in those countries. So working with the entire hospitality industry, the airlines in the international sense, Japan Airlines, Korean Airlines, ANA, and really having a conversation about what they can do prior to their customers boarding a plane. So within the state of Hawaii, what we are looking at is, can we create an integrated system involving hotels and visitor attractions, tour companies, everyone involved in the hospitality industry, to create a layered screening process so that everyone is looking for disease in a way that's appropriate, so that we can identify those who are ill and really have a game plan for isolating them and keeping them away from other visitors, as well as keeping them away from our residents. And as Ed has said, until we can do all of those things, until visitors feel safe to come to Hawaii and knowing that they won't get infected, or that if they are and get sick here, that we can provide them quality health care, we will have a very difficult time reopening the visitor industry.
And Representative Gabbard, if you could weigh in on that briefly, and we'll move on to an inter-island topic. But if it is the feds, whether it's DOT or FAA or whatever the agency is saying, well, you can't deny a passenger access if they're not tested. If just about every state wants to do this, and we're on the tip of the spear, so to speak, with having the quarantines like Alaska does, even Montana now, What about changing that rule? How quickly could that be changed where that could be a barrier for entry?
How quickly is an interesting question. I don't think there's a clear answer to that. Unfortunately, even in this public health crisis, unfortunately, some of these requirements that are in the best public health interest have been relegated to partisan issues. I think it's important to look at something that Governor Ige said, and I think that others have been talking about, is this idea of kind of creating this travel bubble. When we look at some of these other countries that are in a very good place, they have a good practices. They are meeting the benchmarks necessary to say, okay, well, there's a much lower risk of travelers coming to and from these other countries to Hawaii, and therefore more easily being able to instill that confidence that we in Hawaii are not going to be welcoming people who may be carriers for the coronavirus, but also that the confidence is there that Hawaii is a safe place. I think that we've got to pursue all avenues at the federal level as well as at the state level to try to form these agreements that could make this possible, but once again, in a really responsible way and not prematurely jumping the gun, because then we get to a point where there's no turning back, and we'll have to do far more and experience far more suffering and damage than if we just act responsibly and do the right thing now.
Thank you. These next two brief questions are for you, Governor Ige, and these come from viewers. One, Norm Better says he just moved from Oahu to the Big Island and would like his family to visit from Oahu, but they would have to quarantine for 14 days on each side, and he says 28 days seems excessive. When is the state going to make changes for inter-island travel for locals? When are they going to relax this?
We are in intensive discussions with the mayors on all of the islands right now as we speak, Gina. We have been talking about inter-island travel for at least the last 2 weeks, and a lot more intensive discussions and conversations right now. So we've talked about, what systems do we have to have in place to lift the inter-island traveler quarantine. So yeah, it is about screening. It's about, can we do temperature checks in a way that's responsible? How much do we want to be in touch with travelers when they travel inter-island? Can we ask them to be responsible? So if they begin to get symptoms, can we quickly respond to them, give them the healthcare they need, and isolate them so that they don't infect their neighbors and friends on the neighbor islands? All of those are questions that the mayors have that have been put before our team. We're working through each and every one of them so that we can begin to authorize inter-island travel without a quarantine.
Can we push you for a goal of early June if safe?
Well, we definitely are pushing to have it happen as soon as it's safe. There are very legitimate questions that have been raised about what and how much can we place on the traveler. We're trying to use technology to automate that as much as we can. Privacy is a huge challenge, and what can we ask the traveler to give us voluntarily? And how would we create a network so that the communities on both sides of the travel can feel safe? And, as Ed has said, even though we can reopen it, if people don't feel safe traveling, they won't do it. And so, one important aspect of inter-island travel is that it allows us to test all of the systems that we will need to put in place before we welcome visitors from outside of the state of Hawaii. And so our ability to work with the hotels, work with the destinations, to really create, as Tulsi had talked about, the travel bubble. So we know who interacted with each other so that if someone is found to be infected, that we can contact trace all of the people that they came into contact with. Those are the kinds of systems we need to have in place before we can allow travel back.
Thank you. We've had so many questions relating to unemployment, as you can imagine. The latest numbers that we have show about 25% of legitimate claims are still being processed. That's a lot of folks without money. Sue asks, what critical steps are you going to do in order to help people like me? She says, you need to speed up the process. Governor Ige, all these bumps in the road still. What can you do?
You know, certainly, we set up the processing center in the convention center, and we now have more than 500. We started with the lowest unemployment rate in the country and 7 people processing all unemployment claims. Today, we have more than 500 people that is focused on processing the claims. We've distributed more than $700 million to those who have been unemployed since the crisis started. And as you've said, Gina, we've processed more than 73% of all the claims. The remaining claims that we have multiple errors in the application. It does require adjudication. It could be where the employer says the reason for termination is different than what is reported to us. So, those cases that are currently stuck in the system really do require a higher skill level. And we are in the process of building that team so that we can. I just want you to know we had a cabinet meeting this morning, and we are focused on applying resources from throughout state government to really address the backlog in unemployment.
Now, with that topic, a lot of that money is coming from the federal government to supplement the unemployment. And with the topic of federal money that's coming up, Representative Case and Gabbard, can you both discuss how the feds have already helped Hawaii specifically, but what more is in the works? Representative Gabbard, let's start with you.
There's been a significant amount of money that already has come to the state of Hawaii in the form of, plussing up and adding to the unemployment insurance that people are able to get access to, in providing funding for the Paycheck Protection Program to help support our small businesses so they can keep their employees on payroll, the EIDL grant that comes from the Small Business Administration. I think those are areas where a lot of support has gone directly to the people of Hawaii, as well as support that has gone to our healthcare providers, our community health clinics, as well as to the state of Hawaii. There's one big, I'd say there's two kind of gaping holes that we haven't yet seen addressed. The first one, which was addressed in the bill that Congressman Case and I were just back in Washington voting on last week, in that our neighbor islands, our Kauai, Maui, and Hawaii County did not get federal funding directly to the county in the first round of the CARES Act because they are smaller counties. The bill that we just voted on and passed corrects that and makes sure that that support and resources goes directly to counties with populations less than 500,000 people, which is absolutely critical. The second area that I've been advocating for from the very beginning of this pandemic is an emergency universal basic payment, a monthly universal basic payment to go to every individual during this time of crisis. What we've seen is a one-time payment of $1,200, as well as an additional payment for those with children. But a one-time payment of $1,200 doesn't even come close to helping address and provide certainty and security for those who really should only be focused on the health and well-being of themselves and their loved ones. And so this is something that I'm continuing along with others to push for. And we're starting to see more bipartisan support for this idea of really empowering individuals, directly supporting them with a monthly payment of $2,000 so that they can make sure that they have their basics covered and focus during this time of hardship really on what is most important.
Thank you. Representative Case, what more can the feds do? I know you mentioned briefly as well some fixes to the payroll protection program and others. What else do you think needs to be done?
Well, we've passed now, and the president has signed 4 separate emergency assistance bills since early March. And in my office, and I'm sure that my colleagues in the delegation are the same, we have been tracking roughly 75 programs here in the state that have been funded out of those bills that we refer to collectively as the CARES Act. We project that today we have accounted for somewhere in the range of $6.4, $6.5 billion in federal funding already arrived here in Hawaii or to arrive, with say another, it's hard to guess because some of these things are very uncertain. They depend on how many people take advantage of federal unemployment benefits, and how many people remain in our small business paycheck protection program, but at least say $500 million more. So we have seen substantial federal funding already here to Hawaii. We do, though, have unfinished business. The U.S. House passed what we call the HEROES Act last week, which is about a $3 trillion additional stimulus bill, which is supported by folks like the chair of the Federal Reserve. Congressman Gabbard and I both supported that bill. That's our position, and that includes additional billions of dollars, as Tulsi pointed out, if enacted the way it is for state and local governments here in Hawaii. They need that very, very much, and so do so many other areas. So that bill is now pending in the Senate, and we hope that it comes out of the Senate and the president signs it. And then finally, I would highlight the Paycheck Protection Program, which has again helped so many small businesses. Have been highly problematic in many ways, but the principal one is really that you have to spend the money by the end of June. And so the dilemma that our small businesses are put in, especially businesses like restaurants, for example, is they have to spend the money by the end of June, but they have really nothing, they don't have any revenue, so it's difficult for them to actually spend the money by the end of, they really need it after the end of June. And that bill is going to be on the floor of the House. I'm a co-sponsor of that bill to fix several of these problem areas in the Small Business Administration proposals. Those are going to be on the floor of the House. We're going to be flying back early next week to vote on those.
Thank you. I know a lot of businesses will be watching for that one. Governor Ige, I'll give you the final word on this last question. There's a lot of talk about a potential second wave that could come before there's any, wholesale vaccine that's out there on the streets. If we become impacted by a second wave, what will you do differently, or will you do everything the same in terms of how you handle rolling back and reinstating any stay-at-home orders that may need to happen? Will you do anything differently? What lessons have you learned?
Certainly, Gina, I can tell you that each and every business is already behaving differently because of COVID-19, and that's really what we've stressed and in the communication that we have had with businesses and the residents. We continue to emphasize that all of us need to change our lifestyles and change what we do on a daily basis to live with COVID-19 in this era of infectious disease. So it is always, I've done it as a professional, toughed it out when I'm sick. We all have to stop doing that. When we are sick, we need to stay home. Every business needs to rethink about what they do so that they can keep their employees safe. So they need to be provided personal protective equipment if it's appropriate. They need to change the way their customers come into the stores and interact. And we are seeing it every day. When I have to go grocery shopping at Foodland, they've adopted the practices that are so essential to implement social distancing and ensure that people who may be sick don't have the opportunity to infect others. So Gina, I really believe that it's rolling those programs forward, reminding people that we all have a responsibility and an obligation to the broader community to take care of ourselves, take care of each other, and really focus on how we can take care of our community. And so I don't imagine rolling back per se, but it's really about reminding people that we have to step it up and stay separated, which is really not part of our culture, but has to become part of the new norm moving forward.
Thank you very much. And with that last question, we thank you so much, Governor David Ige, Representative Ed Case, and Representative Tulsi Gabbard for participating. And we thank you all at home for watching. Please stay with KHON2 and KHON2.com as we continue to track all of the latest developments with COVID-19 and our state's economic recovery. Thank you and aloha.